Hello everyone and welcome to the Careers channel. My name is Malvin Masango and I'm a medical doctor, and today we're just going to be talking about a career as a medical doctor. So what do you do if you want to be a medical doctor? So for those that are in high school and they are deciding on what subjects to take, you need to take science subjects. And among the science subjects is chemistry, mathematics, biology, physics, among others. When you do pick subjects, you need to understand that chemistry is a compulsory subject to become a medical doctor. Then you can pick any other two science subjects. So in my experience, there is really no advantage of picking this science subject over the other. As long as you're comfortable with it and that's where your strength lies, you can pick the science subject, and it doesn't put you at a better off or a worse off position as you start studying for medicine. So once you pick your subjects for A-level, you obviously need to work very hard to get very good grades, as this increases your chances of being selected for or accepted for medicine. And obviously, you can then choose a medical school of your choice with good grades. So once you have applied to a medical school and you've been accepted to study medicine, it is very key to remain focused, especially in the first few years of your medical school. There is a lot of pressure to adjust to life at university and to also adjust to a new discipline of medicine. Depending on the medical school that you are in, the first couple of years may actually be preclinical, where you are doing science subjects behind medicine. So these subjects may include basic anatomy, biochemistry, physiology, and other subjects. So normally in the first 2 years, due to the immense pressure that you get subjected to, we see a lot of people dropping out, even without failing, and some people actually do fail and they have to change programs. So everyone who's admitted into medicine is well capable of going through the program. But unfortunately, we find some students dropping out or even failing, especially in the first few years. It is important to remain focused and determined, because you are well capable of going through this program as long as you have been enrolled. So according to the system that I studied in, the first 2 years, like I said, is preclinical, where you're mainly doing the science subjects behind medicine. But in the third year, going up to the fifth year, you are now in the clinical stage of study, where you are actually getting into the hospitals and you're actually beginning to see patients. And you start doing clinical subjects, including general medicine, general surgery, obstetrics, gynecology, pediatrics, and other subjects that also support clinical practice, like pathology. So usually once you've gone through the preclinical stages, you will find the clinical stages more interesting and less taxing in terms of time. However, it's important to remain focused and to remain dedicated to your studies, and also to just give yourself up for learning. This is where you learn as much as you're hungry for, because once you get to the wards, it's how much you are looking to learn that you also get to learn. So once you get to the clinical stages, you start going to the wards and you start meeting a multidisciplinary team that includes the nursing staff, your other senior doctors, the radiotherapy staff, radiology staff, the lab staff, physiotherapy, among many other disciplines of medicine. It is important to remain humble as a doctor in training, because most of the things that you learn in clinical stages, you actually get to learn them from people that are experienced and that have been there for a long time. And this includes your senior nurses that have been working in those departments for a long time. So you need to remain humble and be open to learning. So as you're rotating through the various disciplines of medicine, you find small teams headed by a specialist, who's often referred to as a consultant, and you rotate mainly through fourth year and 5th year, which is your final year. There is obviously, various durations for medical training depending on your medical school, but I'll talk about, the setting that I trained in. So as you get to your final year, which is your 5th year, that is the time that you will be examined for the subjects, clinical subjects that you have taken from year 3 to year 5. And the exams will include a practical component. So as you are going through your clinical stage, you get access to doing procedures on real patients and also assisting your seniors as they're doing major operations. So part of the exams, the practical exams, you're given real life situations. Some you're actually given real patients where you need to make a clinical assessment, take history, make a diagnosis, and give a treatment plan. The other part of the exam, obviously, will be a theory exam where you sit down and write your theory exams. Some are multiple choice questions. Where I studied, you get negative marking, which means you get -1 if you get a wrong answer. But all that is part of the final year examinations. It's important that in the final year is the time you really need to give that final push and to just remain focused and put in more time into studying so that you can sail through your final year of medicine. Again, it's important to work in teams because you learn from your colleagues, you learn from your fellow students, senior students, you learn from your other colleagues within the profession, including your nursing staff, lab staff, and radiology staff, but also you learn from all the senior colleagues that are in training, known as registrars. You may identify a mentor, someone who's going to hold your hand and also take you through the clinical stages of training. So once you write your final year exams and you do pass, then you can graduate as a medical doctor. You, however, need to take 2 years of internship as a junior doctor, during which time you are also rotating through the various disciplines of medicine that you have also done during your clinical stages. That includes general medicine, general surgery, the other specialties in surgery including orthopedic surgery, ophthalmology if there is, but also pediatrics, obstetrics and gynecology. All those disciplines, you get time to rotate through them so that you build your confidence and you get experience. So during the time that you are rotating as a junior doctor, this is a time that you are consolidating what you have learned in your clinical stages. This is also time that you get time to be hands-on on real-life situations with patients, but under the supervision of more experienced colleagues. So upon successful completion of your internship, you get signed off and you can register as a general practitioner. This is time that you can work without any supervision, but this is not to say you cannot ask anyone for any advice. It's important to continue to learn from other colleagues and from your senior colleagues as you build your career as a medical doctor. So once you start working as a general practitioner, this is when you mainly work in hospitals and you are involved into day-to-day care of patients, consulting, making diagnosis, and instituting treatment. So with regards to specializing, you may be able to go straight into specializing after completion of your internship, but in some settings you may be required to serve a year or so of community service. Clinical specialties usually take 4 to 5 years, so this is something that you really need to consider and find something that you've developed passion for over the years. Some of the clinical specialties include general medicine, general surgery, pediatrics, that looks into children, obstetrics, gynecology, oncology, that includes treatment of cancers, among other specialties. There is non-clinical specialties that you can also take up, and these include public health, which includes disciplines like research, epidemiology, health economics, and many other managerial disciplines. It is important to note that a career as a doctor is not only limited to a hospital setting. There is doctors that work outside the hospitals, and these include people that work in the various ministries of health, people that are focused on designing and implementing health policies, people that are managing and running various programs, and also various non-governmental organizations. So what do I do in my spare time? Obviously, apart from reading and researching, I'm also into cycling. I choose to live a very active life because it has got immense health and physical benefits. That includes reducing the risk of non-communicable diseases like diabetes, high blood pressure, heart diseases, and many other diseases. It is also important for your mental well-being as well as psychological well-being. It reduces the risk of things like stress, depression, and many other conditions that are associated with a sedentary lifestyle. So I strongly recommend that you find a sport or a physical activity of your own choice as a hobby, as this has got numerous and immense benefits to your own health and your own well-being. So you may want to know what inspired me to get into medicine. During my high school days, science students with good grades were encouraged to take up careers in medicine, in engineering, being pilots, among other things. I decided to take up a career in medicine, and that turned out to be something that I thoroughly enjoyed. Medicine is a vast profession with a lot of disciplines. It's a profession that you see the impact of what you do on people's lives. It's something that is thoroughly fulfilling to me as a person. And it is also a profession that is still on high demand globally. Medicine is a fast evolving field, and it is important to remain relevant in the field of medicine. You need to keep abreast with the latest practices, the latest information, and the latest trends in the field of medicine. It is important to be part of the various associations in the various fields of medicine where these trends and the latest technological advancements are shared. So as we end, I'll just give general advice to someone who may be considering getting into medicine. Make sure this is something that you are passionate about and you also love and enjoy working with people. You may also be required to work beyond the normal 8 to 5, as you may be attending to emergencies, you may be working on holidays, or you may also be on call. But besides that, this is a career that I find thoroughly fulfilling, and I would encourage a lot of people to join the career of medicine. All the best and goodbye.